In this video, I will go over the clinical features of phenylketonuria and alkaptonuria, both of which are autosomal recessive disorders. So here is an important metabolic pathway that you have to be familiar with. It shows how phenylalanine can be converted to tyrosine, which can be later on converted to dopamine, norepinephrine, and epinephrine, and how melanin produced from dopa via the tyrosinase enzymes. So the examiners can ask you many different questions on this pathway. Like for instance, they can ask you, what is the cofactor that is required for the conversion of dopamine into norepinephrine? And so the answer would be vitamin C. Or they could ask you deficiency of which of these enzymes is associated with albinism. And so the answer would be tyrosinase enzyme. Now the question that I have for you here is that deficiency of which of these enzymes is associated with alkaptonuria? And the answer is deficiency of homogentistic acid dioxygenase is associated with Alkaptonuria. And now the next question is deficiency of which of these enzymes or cofactors is associated with phenylketonuria? And the answer is deficiency of phenylalanine hydroxylase, or its cofactor, which is tetrahydrobiopterin, can cause phenylketonuria, where there is increased concentration of phenylalanine, while there could be normal or decreased concentration of tyrosine. So first I would like to start with phenylketonuria, and then I will discuss alkaptonuria later on. So starting with phenylketonuria, as we just discussed, this is an autosomal recessive disorder that is associated with elevated concentration of phenylalanine, as a consequence of which there would be intellectual disability. And it's thought that intellectual disability could be from inhibited brain growth or decreased production of the neurotransmitters, like for instance epinephrine or norepinephrine. These patients also have hypopigmentation, and so since phenylalanine cannot be converted into tyrosine, these patients are dependent on their diet for the supply of their tyrosine. So tyrosine could be normal or decreased in these patients. And if tyrosine is decreased, therefore there would be also decreased level of dopa, as a consequence of which there would be decreased melanin. And so these patients will have hypopigmentation. And then finally, these patients can present with mousy body or urine odor, and this is due to the increased concentration of the metabolite phenylacetic acid. And then dietary restriction of phenylalanine is required for the treatment of patients with phenylketonuria. The next condition is alkaptonuria, which is caused by the deficiency of the enzyme homogentistic acid dioxygenase, as a consequence of which there would be increased concentration of homogentistic acid. So here we have Alkaptonuria, which is also an autosomal recessive disorder, and there is increased concentration of homogentistic acid. And so this homogentistic acid will polymerize and form a pigment that is deposited in connective tissues, like for instance in the ear cartilage or in the sclera, and causes brownish discoloration. And so the term for the deposition of pigment in the connective tissue is referred to as acronosis. There will be also deposition of the pigments in the joints, which will cause acronotic arthritis that presents with limitation of the motion of the joints that has resemblance to osteoarthritis. And then the third feature of this disorder is black urine. So once these patients urinate, initially the urine will have a normal color, but once the urine gets exposed to air, air will oxidase homogentistic acid and give urine its black discoloration. Alright, so next I would like to review these disorders one more time. So phenylalanine is converted into tyrosine via the enzyme phenylalanine hydroxylase with the help of the tetrahydrobiopterin. And tetrahydrobiopterin is dependent on dihydrobiopterin reductase for its production. So deficiency of either one of these two enzymes can lead to phenylketonuria, where there is elevated concentration of phenylalanine. So phenylketonuria is an autosomal recessive disorder that is caused by deficiency of dihydropterin reductase or phenylalanine hydroxylase enzymes. These patients can present with intellectual disability, which is thought to be due to inhibited brain growth or decreased production of the neurotransmitters. Other characteristic features of this disorder is mousy body odors due to the accumulation of the metabolites. There would be hypopigmentation from decreased melanin synthesis, and then seizures would be another feature, again, that can present in these patients. There could be normal or decreased concentration of tyrosine while there is elevated level of phenylketonuria, and so for the treatment of these patients, it's important to restrict phenylalanine in their diet. Now, most of patients will have enough dietary supply of tyrosine, but if there are some patients that have low level of serum tyrosine, then in those patients tyrosine supplementation is definitely required. And then finally, we have Alkaptonuria, which is autosomal recessive disorder due to the deficiency of homogentistic acid dioxygenase, as a consequence of which there is increased accumulation of homogentistic acid, which forms a pigment that deposits in connective tissue, like for instance in the ear cartilage or in the sclera, and causes discoloration of those connective tissues. Likewise, deposition of the pigments in the joints can cause arthritis that resembles osteoarthritis, and finally presence of homogentistic acid in the urine can give urine a dark color once it stays standing exposed to air, and this is due to the oxidation of the homogentistic acid, which gives urine its black color. And that concludes our discussion of the phenylketonuria as well as alkaptonuria disorders.